is it though?
Oh yes, just let me get myself organized. I know I have.
Busy shift?
Yes. Everything that can go wrong always happens at night. Oh, got it. Okay.
Alright, let's do this.
So, Mrs. D in room 3750 is as cute as a button. So she's got quite a few things going on though, alright? So this is her past medical history. Get ready to write it down. Okay, so she's got end-stage renal disease. So she does have a peritoneal dialysis put in with a catheter. She has lupus. She's got type 2 diabetes mellitus. She's got hypertension, gout. She's got peripheral artery disease, osteoporosis, hypothyroidism, previous GI bleeds, and just a cherry on top, she's got really bad necrosis of her left foot.
Oh, good.
Yes. So, I did check her 10-cough catheter and everything is well, the dressing's dry and intact.
Okay.
And
how long has she been on dialysis?
well, she has been on dialysis for about 2 years now. And she's doing good though. Other than that, she just has everything under control with her family. She has a really big language barrier. She speaks only Vietnamese, and she's got family there all the time. So.
And can her family speak English?
Yeah. Yeah.
Oh, okay.
Yeah.
Right.
Okay.
Have you guys tried to use a translator yet?
No, not yet. We might do that. So I've been looking at her labs, and she's been getting darbepoetin, erythropoietin injection for her anemia. So I just keep an eye on her hemoglobin and red blood cells. It doesn't look like it's been working as of yet, but we can just keep an eye on that.
Okay.
Other than that, I've given her 5 units of hydromorphone and it's worked for controlling her pain pretty well, but she's still got, from what her daughter tells us, she still has about 8 out of 10 pain. So just be careful touching the toes, they're about to fall off. So we're gonna have vascular surgery and ortho coming in to do a consult with her. They're probably gonna think about doing a amputation. So there's a lot to do there. Yeah.
Wow. Could all this really be due to diabetes?
So as you can see, a lot of things are due to diabetes type 2.
Wow. Alright, so for today, I would say my main priorities would be pain management for sure, especially if she's still having 8 out of 10 pain with all the narcotic. Definitely watching her labs. Might have to have a transfusion, see how that goes. And then definitely just trying to see what's going on with the language barrier. Definitely trying to get a translator in there if need be to figure out what's going on.
Right.
And watching those toes.
Watching those toes.
Hopefully I don't have to pick any off the ground.
Yes. And as of right now, her blood glucose is controlled.
Okay.
We did her sugars this morning, and it was at 6.2. So she is under control right now, but just keep an eye on those blood sugars.
Okay.
All right. Have a good shift.
Good. Thank you. Get all your stuff. Oh my gosh. Good morning, Mrs. D. I'm Carrie Ann, your student nurse today. I'm gonna take care of you. Just gotta get my hands clean. you feeling today? Where are your daughters?
What is she even saying to me? I can't understand her. Oh, is she saying pain? Yeah, pain.
Foot. Okay. Yes, Mrs.D, what do you need? Your foot? Painful? I can't give you any more meds. Oh, I don't know. Oh, are you the daughter?
Yes.
I'm Carrie Ann. I'm the student nurse for today.
Womp 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 womp. I womp 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 womp.
Pain, feet, down. Okay. Feels better when they're on the edge of the bed? Yes? Okay. Let's sit her up then. Just pull her shoulder and I'll... Okay. Okay. That's good. Do we need... How is that? Why is she so sick? How in 4 weeks it went to this? How? Why? Well, it could have something to do with her diabetes. Lots of pain, no sleep, very tired.
Yep, I definitely see that. Yep.
Hello, gentlemen. Ned from Nephron News.
Carl, Cardiac Central.
Ralph, Retina Retro.
So do you fellows know what's going on today?
I feel the tension, but I'm just not sure.
Yeah, definitely. I hear hyperglycemia is still on the loose.
Yes. You know, I hear Detective Foreman's actually on the case, and he's going to be talking to us today.
Detective Foreman, yes. Have you met Foreman?
Of course I've met Foreman. That guy's a legend.
Yeah, definitely. Yeah.
Well, it looks like they're he's kind of
Yeah.
Good evening, gentlemen. Detective Foreman here. Hyperglycemia. She goes by the street name Sugar, and she is recently going on a rampage, wreaking havoc on the system. We are holding this press conference to alert everyone of not only what she's doing, but what she is capable of. She is slow moving, but she is quite dangerous.
What has she done?
Well, let me tell you. Sugar has been charged with 2 counts of renal damage and 2 counts of necrosis. We're suspecting the artery has been an accomplice since they've been going steady back in November. Take a look at him here when he's a slim Jim. Now take a look at him since they've been going steady. Hyper has really thickened him up. We suspect that the next target is to destroy the whole vision sector. What are you going to do about it? Well, right now, our main focus is just go straight to the left foot and check out the casualties. All right, kid. Let's head down to the left foot and see the damage Sugar's done.
Sure thing, boss.
On their way down to the foot, Detective Foreman and his sidekick received news that Sugar and Artie had already invaded other areas of Mrs. D's body. The damage caused by their evil doings caused Mrs. D to experience other systemic ramifications, including systemic hypertension, retinal deterioration, tissue necrosis, and osteoporosis.
Since we're down this way, do you want to see the damages happening in your kidney?
Yeah.
Hi, this is Ned from Nephron News. I'm glad you stopped by here at the kidneys. As you can see, we've got some kidneys on strike. This is all due to Mrs. Hyperglycemia's work. She's been killing nephrons, and we've got some very stressed out kidneys. As you can see, fluid's accumulating here, and we are not getting filtration.
Hey, Neuron, you look a little different. Did you do something with your myelin?
It's gone.
All right, Artie, you listen here. I'm gonna go into the left foot, and I need you to keep watch, okay? You make sure that no blood gets to where I am.
You got it. You got it, hyperglycemia. Thank you.
Hands up, neurons.
Oh no! She's back! Who's back? What are you talking about?
My name's hyperglycemia, otherwise known as sugar, and I'm here to slow you down a little bit. I don't want you sending no messages up to the big boss, up in the head. That's better.
Look, there she is. What is she doing to those neurons?
We meet again, Foreman.
I got you.
You know you're not strong enough for me, Foreman.
Damn it! She's gone again. She's out of control. We need to call in the big guns.
Who's that?
The IU.
Who are the IU?
Insulin units. Hello? It is a mess down here. I can't imagine what it looks like from the outside. There's no signs of life. Alright? Alright. Send in some of your units.
How's it going, Carrie-Ann?
It's alright. I just have a question for you. You see, I was looking, her hemoglobin has been trending around like 77, hematocrit, not doing so great, due about 0.23, and it's been trending that way for a bit, and I know they've been giving her the EPO shots, and they're obviously not working. She's very tired, she looks she's pallor, like it's very clear that she needs something else to happen.
Yeah, and this is very common. You'll see with lots of kidney patients that this is anemia is a common thing. So looking at her hemoglobin now, that it is quite low, what do you think the physician's orders are going to be?
I think it's going to be a blood transfusion.
I think so too, and I think that's a great chance for you to practice your skills of
Yay.
getting blood.
Also, I was just noticing, the nurse this morning, I don't know what she was talking about, but she said her blood glucose has been controlled at about 6.1. It's actually at like 18 and has been for the past couple times they've done it.
Okay.
So,
Well, she could have been tired, or a lot of times if you get a spike in glucose, it can be for a few reasons. We do know that she has necrosis of her foot, and she's fighting lots of infections. It looks like you're giving her a lot of antibiotics, right? So that could also be the reason for her all of a sudden increase in blood glucose. So let's keep an eye on it though, and then we'll see what interventions we need to use.
possibly some insulin?
Possibly.
All right, let's go do that.
All right.
Metformin was no longer effective in treating Mrs. D's hyperglycemia. A sliding scale insulin order was put in to control her rising blood glucose levels. Additionally, an order for 1 unit of packed red blood cells was put in to treat her anemia.
Mrs. D, hi.
Womp 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 womp, Mrs. D. Womp 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 womp, Hillary. Womp womp womp.
So we brought in the translator to help me tell you what's gonna happen. So we're going to be giving you some blood because your hemoglobin and your red blood cell levels have been low, which explains also why you've been so tired. And so the shots that they've been giving you, the erythropoietin shots, have not been working. So this is what we have to do. So I understand that you've had a reaction before to blood transfusions. And what happened with the reaction?
So she felt like she couldn't breathe, and she got really itchy.
Okay. So we'll make sure to watch for that again. But this is what needs to happen as an intervention right now. So I'm gonna come back with my primary nurse and hang this blood for you. Get that started. That's okay? All right.
That was great. Now I feel like I can really communicate with my nurse.
Thank you.
Hi, Carrie Ann. How's it going?
All right. Just doing my charting.
How did hanging the blood go?
Oh, it was good. It was so scary though.
Yes. Always, the first time's always a little bit scarier. So why was it scary?
Oh, because, well, the doctor had mentioned that she had had a previous reaction to it. So they were keeping a close eye on it just to make sure that it didn't happen again.
Okay.
So making it even more scary.
Right. So lots of vitals.
Yes.
Yeah. So what kind of things would you be looking for when there's a potential for a blood transfusion reaction? Correct. So, if you're looking for all of those things, then you can really be aware of what's going on with the patient and act proactively and think critically.
Of course.
Which is all we teach you in nursing school.
yes, nursing school.
Right.
So fun.
So I'm just gonna go help Bailey put a catheter in,
All right.
and I will catch you in a little bit, okay?
See you later.